again. I wanted to come out and make this video because a lot of y'all are going to be splurging on Valentine Day and doing a lot of things. I hope you spend time for yourself. Most of us may be working. I'm not. Thank you. Anyway, I was talking to this nurse the other day, one of my friends, travel buddy, and we were talking about the type of patients we like to work for. First of all, I don't like it when I don't think there should be special treatment for special patients. This is my opinion. Don't knock me for that. This is how I feel. I feel everyone should treat all the patient, rich or poor, the same. I'm often hesitant when I get the report that, oh, this is the father or the mother, the sister, the brother, or whoever, family member for the CEO or the vice president, the nurse manager. So be careful, Patrice. First of all, let me back up. They don't give me those type of patients. Not because I don't know how to treat people right. I don't know how to pamper, fluff the pillow, boom, boom, and keep going at it. I know how to treat people. But they normally don't give me that. They call it the perks. Do you know there's certain hospitals on certain floors that are blocked off and only certain nurses can work there, and those are where the ballers, they're the ones there, they're sick and they're up there. Only certain nurses. And one day I was talking to a nurse. I said, what's going on up there? You went up there? You looking good? Your blonde hair look good? I know that's your hair. Blonde, blue eyes. You up there? Slim thing. What's going on up there? She said, so-and-so is up there. And I don't know. I said, I thought you wanted to go up there. She said, girlfriend. They had me running all night long. All night long. Because when you have to be mindful, nurses. When you get those kind of VIP patient, family member, your job is on the line. So you better be in there. They knock on the wall. They spit, they cough. You better be right there. Can I get the bedpan? Can I wipe you? Do you need this? Do you need that? Okay. I'll let I'll call dietitian right now. You won't be able to do anything for the other patient, and that's the reality. You will be in that room. You might as well get the chair, the medication cart, and stay right there. Or you will hear the quick, 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 quick. That's the med cart, the old creaky med cart going all night long, running to that particular room just to fluff the pillow, just to make them comfortable. Now, I don't have a problem with that. If it was my mother, I want her to be treated that way. But the difference is, and I did have a VIP patient. I think I told you the story before. I made the wrong mistake. I thought that was his daughter, and that was his wife. Way, way younger. But then that's the thing. Sugar baby, sugar mama, whatever they call them. And I made the mistake and said, oh, your dad. She said, oh, no, that's my husband. I'm like, oh, my God, I'm sorry. And I learned my lesson then. But you have to learn those lessons. Never make those mistakes. But I had to be in that room. I had to stay at that door. I had to call people on the phone because, they give you a phone when you work med surg. I wasn't in psych. Psych, patient, family don't necessarily comes only on visitation. They're allowed on the unit, and they're only allowed in specific close off space, maybe the break room, but not in the patient bedroom. So, and usually the nurses are out there in sight monitoring that the patient family don't stray off into the bedroom, or, because it could be boyfriend, it could be people carrying stuff that they're not supposed to give the patient, because in sight we don't allow them to bring in outside food. Just a little FYI for you nurses who might want to go into psych. So I was in that room 24/7, and I had to call people. Can you please go check my IV in the other room? And it makes the other nurse annoyed with you because they can't do their work, because they have to do their work, which is hard. Med-surg is hard. They have to do your work on top of their work. So they get a little annoyed with you. But you got to make it look good. This is the patient that I had. He played golf with the CEO. Now, if he go back and say, oh, that nurse Patrice, she had an attitude. We always have an attitude. She didn't come in here the whole night. She didn't empty my Foley. It would be a ripple effect. And believe it or not, I would not keep that job. So I don't agree with it. I don't like to work in an environment where I'm going to exclude others. One thing I notice, and this is my opinion, one thing I do notice when I work with patients, and I've worked in the Bronx, I went to Temple University. I work in Temple University. I work in the hood, if you want to say that, in the African American community. The patients, majority of the patients, they're very sick because, diabetes, hypertension, and they're more appreciative of me, more appreciative of the nurse. Even some of the people I work with in New York, they're more appreciative of the travel nurse. It's not a lot of, I would say I had a lot of negative experience. I wouldn't say that. I didn't. I became friends with some of those nurses, and the patients were so appreciative. Those little elderly ladies and the guys that, that you came to my room and you did what you have to do. I know you're busy. Keep it going. Do you want a pain pill? No, I'm not in pain. Just keep going. But I just want to make sure you have what you're supposed to have. But in other settings, I feel like I'm not effective as a nurse because I'm just doing maid service. I don't know any way how to put it. I'm just there pampering it so that they don't give a bad impression for the hospital. Don't get the CEO family treated right. Mark you, we're going to treat your family right. You don't have to tell me in report that's the CEO mother. You don't have to tell me, because I had family member come in the hospital. They don't go, oh, that's my daughter, that's my son, to their, they don't, they get treated the same for everybody. And in nursing, when you put that extra burden on me, and it's only, I don't know about you. If you like that kind of environment, that's fine. I did not get to go up to the boiler room because it's, I don't know how management picked the nurse, but they do pick certain nurse. Usually, I don't want to go into it. The type of nurse they bring up there that they feel is going to do a better job. They mostly give. The only reason why I had that VIP patient, because nobody else wanted it. See, they'll give you what nobody else wants because nobody else wants to deal with it. But the usual, what the management do is pick the best nurse, the ones that they said is the best, will do the job, will do stay in the room while you do, it's just, that's politics. That's all I can say. I remember one day, I think it was in Philadelphia, and maybe I'm straying off from this subject, but I just had to tell you about this. There was a young lady, and she had sickle cell. So, sickle cell is only, most of the time is in the African, majority of time, it is African American. And she was like maybe in her 20s and not a VIP. I didn't get the patient. I didn't have the patient. I had all the patients that were heavy, sick, because, I'm travel nurse. You know what they do when they give you travel nurse, they give you the worst. But the nurses that had her, the young nurses, new, just got out of school, not going to be here long, those type, those type. So they had the patient. But it bothers me because at the nurse's station, what they were saying about the patient, I didn't like it. I didn't like this girl didn't want to take a shower. She stink, this, da. And it was bothering me. Something about my heart just feel I'm hurting, but I can't say anything. I'm a travel nurse. So if I speak up, if I say, why don't you, I don't want her. I hope I don't have her tomorrow. Next day I came in, who has her? Me. So I went in the room and I said, I understand now because I don't go in, you're not allowed unless the other nurse asks you, can you come help me, or the CNA, whatever. But I normally don't go into the patient room unless I'm going to check the IV because it's going off or answer their lights. But I don't mingle with the patient, with the nurse's patient. And I'll make another video. Why? Because some nurses, they act like they own the patient. Even with a light, and you go answer the light, they'll get upset. Don't mess with my patient. Never heard such a thing. Because in nursing school, all the patient is your patient. You need to know them, and you need to answer the light. Don't let it go off. Oh, Jenny will come back from break. She can answer her own light. Who does that? Anyway, so I went to the room and I introduced myself. I'm your nurse for tonight. It was on night shift. And explained to her what I'll be done. I'll give you some medicine. Are you in pain? Whatever. Assess the patient for pain and everything. And I said, I'll leave you. You got your medicine and everything. Can I come back in the morning and give you a shower? Assist you with the shower. How can I help you? Because nobody want the patient, not even the CNA. And I understand the room was filthy. To be honest, as a psych nurse, I think she might be sad for some reason. But they were talking about, the husband came, and I don't understand he could stay in that room and so stink with the baby and everything. He came to visit. So I thought I would make a difference. I thought I would make her feel better. Sometimes when you take a shower, you feel better, right? So I go in there in the morning, and then, she still didn't want to take a shower. Apparently, she don't want to take a shower. So I didn't think nothing of it. I wrote my report and everything, and give report in the morning. She didn't want to get a shower. Next day I came back. She didn't want me. She didn't want me. The one who cared enough was trying to help her, assist her, trying to make them think different. The people that was talking about her hadn't had her best interest, because when she's ringing, they don't even want to go in there. I don't want to go in that stinking room. But she didn't want me. So sometime, as an African-American nurse, dealing with African-American, they treat us different sometime. I didn't understand that at the time. I was hurt because here I am, had her best interest, And she turned around and said she didn't want me, and they were loving it. One more record on the staff, on the travel nurse. One more X that she don't do her job. And I think I did my job. I was going to make them stop talking about this girl. So I didn't have her the next day because they said, oh, they made sure. About 6 of them came to me. Oh, she didn't want you. Why? They couldn't tell me why she didn't want me again. I'm not going to push. Maybe. That's my conclusion. If the doctor says Q4 hours morphine, then that's what I'm going to do. If you tell me that it's not, then I'm going to call the doctor. It's not effective. You've been getting it every 4 hours. It's not working. And I understand, because people with sickle cell, it's a lot of pain management. So when I called the doctor, and the doctor said, no, I think she's going beyond that. 4 hours, let's stick with that. There's nothing I can do. So I don't know what those nurses were doing. Maybe they were doing it, and I don't want to say, giving it a little early. Because, you can document whatever. But now Epic, the computer, they on ball. They won't let you do it. But I'm pretty sure. Anyway, so I try my best to do the right thing. But sometimes when you do the right thing, they don't see it that way. Just an FYI, I just thought about this story. So I don't like working in that kind of environment. I don't want you, if there's a mother involved, a daughter, whatever family member, just give me the regular report. Don't give me a report. And I don't like when nurses give you a report. Oh, yeah, she's the, that's the stinking one, or this patient did, and she just messed up. This, that, why, la, la. You know what I mean. Let me know what you think. Rich, wealthy patient. There's no tip involved. I don't know what they do in the baller club. I call it the baller unit. Because I know they balling your way every day, everywhere. Stay right there at the room. I'm not talking to this one. I don't like this one.